We're with Dr. Jay Butler, Director of the Division of Public Health at Alaska's Department of Health and Social Services. Dr. Butler, are opioid overdoses becoming an epidemic, and what does that term actually mean?
Well, epidemic means an increase in a health event that's beyond what would be expected. And we usually base what is expected on historical averages and what's our past experiences. In the case of opioid overdoses, there has been a tripling to quadrupling over the past 15 to 20 years. So I think this really meets the definition of epidemic by anybody's standards.
Okay, and how much of that is due to legal prescription drugs such as oxycodone versus illegal ones such as heroin? And what are the other different drugs out there that play a part in this?
Well, much of this epidemic was initiated through prescription opioids. There was an increase in the amount of opioids that were prescribed, basically a 3 to 4-fold increase between the late 1990s and 2010. And we saw an increase in overdose deaths that really mirrored that increase in prescribing. Now, that use of prescription opioids then created at the population level a much larger group of people who were opioid dependent or had addiction to opioids. Then heroin came in, cheap, available, and very high quality and purity. And this filled much of the market, and many people began using heroin because it was sometimes cheaper, easier to administer because the opioid prescriptions had more often than not changed to abuse deterrent formulations, which were difficult to prepare for injection. And then more recently, we've seen increase in fentanyl use. These are oftentimes powdered fentanyls that can be obtained over the internet. They can be mixed with heroin. They can be pressed into pills that can be abused. And on the wholesale market, fentanyl can be up to 1/20th the cost of heroin. So economic drivers have been critically important in terms of continuation of this epidemic, even as the number of prescriptions for opioids has leveled off and even begun to come down slightly.
Okay, so tell us a little bit about the steps that states are taking to address the epidemic, and what has Alaska specifically done?
Well, states are taking a multitude of approaches, and I think that's the most important thing to realize is there's no magic bullet. There's no one policy measure that's going to address this. It takes multiple approaches, and it takes an all-hands-on-deck approach. That it's not just a health problem, it's not just a criminal justice issue, it is a very broad issue. We cannot treat our way out of it, we can't incarcerate our way out of it, we can't educate our way out of it, but it does require a health-based approach, it does require a criminal justice approach, it requires education, it requires a broad-based approach. In Alaska, we have taken a number of measures to address the opioid epidemic, including addressing some of the in-stage outcomes, the overdose deaths, specifically through law that has allowed a statewide standing order to distribute naloxone to people, which can be life-saving, and we have a number of reports of lives saved through the naloxone program. Increasing access to treatment, which is probably the next big thing we need to move into, because naloxone is not a cure for this problem. It is life-saving, but it doesn't change the underlying addiction. And then getting into some of the primary prevention measures in addressing the needs to self-medicate, as well as the supply of addictive substances. The latter can be addressed in the prescription opioid side through more judicious use of opioid drugs, use of things like prescription drug monitoring programs. On the illicit drug side, taking measures to limit the supply of illicit opioids that are available. And probably most importantly is getting into some of those issues that drive the need to self-medicate. And if we take a molecule-specific approach, we're probably not going to make a lot of progress. We have to look at what are some of the issues that drive the need to use any addictive substance, and how can we reduce that need.